Hello everyone, welcome back to Patho Excellence. In this endometrial pathology video series, today we are going to learn endometrial metaplasia. So let's understand what it means, why it occurs, and how to identify it under the microscope. So what is definition? Endometrial metaplasia is defined as the replacement of the normal endometrial epithelium or stroma by another type of mature epithelium that is not normally present at that site, and usually it is due to adaptive response to chronic inflammation or irritation or hormonal stimulation. Now classification. This metaplasia can be broadly classified into two main groups. First is epithelial metaplasia, in which there is transformation involves the surface of endometrium or glandular epithelium of the endometrium. Now, what are the types of epithelial metaplasia? So, squamous metaplasia, mucinous metaplasia, tubal, eosinophilic, clear cell, hobnail, or papillary syncytial metaplasia. We will see it one by one. Now, second type is stromal or mesenchymal metaplasia. This is rare metaplasia as compared to epithelial metaplasia. So, transformation involves the stromal cells of the endometrium, and the types are osseous metaplasia, cartilaginous metaplasia, adipose metaplasia, synovial-like metaplasia, smooth muscle metaplasia, and glial or neurogenic metaplasia, which is rare in nature. So, whenever we see epithelial and stromal metaplasia, we have to keep in mind that mostly the epithelial metaplasias are due to hormonal stimulation, and stromal metaplasia is generally due to chronic irritation or inflammation. Now, what are the different epithelial metaplasia look like? So, this table shows key morphological features and some ancillary studies which will help us to differentiate it from different metaplasias and what is the clinical significance. So, first of all, squamous metaplasia. So, it contains typical squamous elements comprising of squamous epithelium with keratinization, intercellular bridges, and or prominent cell membranes, and bland nuclei are there. So, there is risk of endometrial hyperplasia, carcinoma, or associated with endometriitis or chronic pyometria. When this is in extensive nature, it is called ichthyosis uteri. Now, morules. These are again a squamous type of metaplasia which shows syncytial sheet of cell or rounded aggregates which is looking like mulberry and having eosinophilic cytoplasm. Nuclei are bland and indistinct cell border is there. So, if we see IHC marker, CDX2 is positive. Here again, risk of endometrial hyperplasia, carcinoma, and sometimes normal endometrium or benign endometrial lesions can show this type of metaplasia. Tubal metaplasia, larger number of ciliated cells with bland nuclei present in endometrial glands looking like a fallopian tube-like epithelium. Here it is P16 positive showing mosaic pattern in IHC. Now occasionally associated with anovulatory cycles or other high estrogen states. Now eosinophilic metaplasia, as the name suggests, there is abundant eosinophilic cytoplasm with bland nuclei, and mostly it is non-specific and may be found in normal endometrium, benign endometrial lesion, endometrial hyperplasia, or carcinoma. Mucinous metaplasia, here we will see cells with intracytoplasmic mucin with bland nuclei, mostly simple architecture without any complexity, and atypia. It is associated with hormone replacement therapy and commonly in the tamoxifen associated endometrial polyp. There are subtypes of this mucinous metaplasia. One is intestinal metaplasia, second is gastric. So in intestinal metaplasia, there is goblet cell and neuroendocrine cells with an intestinal type epithelium, and usually it is CK20, CDX2 and Wilin positive. It may be associated with intestinal metaplasia in other gynecology sites. Gastric metaplasia, it resembles benign gastric type lesions of cervix. Here, MUC6 and HIK1083 positive may be associated with synchronous and multifocal mucinous lesions of female genital tract. Now, papillary syncytial metaplasia. So, here syncytial aggregates of cells with eosinophilic cytoplasm and syncytial look, so indistinct cell border. Here pseudopapillae with cellular tufting and stratification is there, and here the neutrophilic infiltration is generally present. And this is reactive change associated with endometrial breakdown. Hobnail metaplasia, we can be confuse it with area stellar reaction, which is generally in gestational endometrium. So here it is present in non-gestational endometrium, showing clear cells with clear cytoplasm, rich in glycogen and bland nuclei, and may be associated with tamoxifen usage. Now, papillary proliferation, uh, it shows true papillary structures with fibrovascular core, variable degree of branching, but no cytological atypia. There is risk of endometrial hyperplasia or carcinoma if complex or extensive papillary proliferation is there and typically identified in association with endometrial polyp, and some other types of metaplasia may coexist. Now, in this section, we can see surface epithelium of cuboidal type here in endometrial section, but this part show mature squamous epithelium. So, what is this? It is squamous metaplasia. In this section, we can appreciate endometrial glands which are showing back-to-back arrangement. So, this is a case of endometrial hyperplasia. The metaplasia here is showing a round aggregate of squamous cells having abundant eosinophilic cytoplasm, bland nuclei, and cytoplasmic border is little bit indistinct. So, this is called morule. Here, this is a beautiful slide. Here we can appreciate endometrial gland with its normal component along with some abnormal, or it is called change in the epithelium, where we can find ciliated cells in some part of this gland. So this is ciliated metaplasia or tubal metaplasia. In this slide, we can see normal endometrial gland and stromal component, but few glands show abundant eosinophilic cytoplasm. Here, the normal part and some part showing abnormal or pink eosinophilic cytoplasm, abundant in nature. So, this is eosinophilic cell change. Here, this section shows normal part of endometrial gland stroma, but this gland show mucin intracytoplasmic in nature and bland nuclei located at the basal surface of the gland. So, this is mucin containing gland. So, this is mucinous metaplasia. This is again a section of polyp showing a few dilated glands, a few tubular gland, thick blood vessels, but the change here we can appreciate, which is shown here with the arrow, is glands with mucin in the cytoplasm. So this is gastric type of metaplasia in the endometrial polyp. This section here, we can appreciate stroma in gland, but the glandular epithelium, it is replaced by syncytial-like aggregates of cells with some papillary tuft, and this show abundant pink eosinophilic cytoplasm with indistinct cell border, and some of the parts show pseudopapillary appearance. So this is syncytial papillary metaplasia, and here it is not clearly visible, but neutrophils are generally present in this type of metaplasia. Here we can see surface epithelium is replaced by hobnail cells. So hobnail cells, as we have discussed, these are the protruding nuclei from the cytoplasm inside the lumen or outside the surface, having pink cytoplasm. It may be confuse us with area stella reaction, which is generally in gestational endometrium. Here, this type of metaplasia is seen in non-gestational endometrial pathology. This is hormonal metaplasia. In this slide, we can see few glands showing intraluminal papillary tuft, and these papillary tufts are having fibrovascular core in the center. So this is called papillary proliferation of the endometrium. Now, these are, we have seen epithelial metaplasias, which are more common as compared to stromal metaplasia. So let's see what are the different types of osseous metaplasias, its key morphological features, and its clinical significance. So first is osseous metaplasia. So here we can find bony tissue or osteoid material blending with endometrial stroma associated with infertility and previous abortion. So history is must whenever we find this type of metaplasia. Now second is cartilaginous metaplasia. So here easy to diagnose. We will find islands of benign appearing cartilage blending with endometrial stroma. Adipose metaplasia, as the name suggests, mature adipocyte clusters which blend with endometrial stroma. Smooth muscle metaplasia, where we find isolated short fascicles or small nodules of smooth muscle cells in endometrial stroma. Then pseudo-rosette-like proliferation. So small discrete of foci of spindly cells in short fascicles, and pseudo-rosette pattern means arranged radially around an eosinophilic central region, which mostly resembles like pseudo-rosette. So this four metaplasias clinical significance is not known, but may be present in some type of lesion. Now synovial-like metaplasia, which is generally present in the eroded surface epithelium, having synovial-like cells having palisaded arrangement oriented perpendicular to the endometrial surface. It mostly associated with levonorgestrel releasing intrauterine device. Glial tissue in endometrium, where we find nodules or polyps of glial tissue in endometrium, and it is often presumed to be present retained fetal tissue. Now, extramedullary hematopoiesis in the endometrium, where hematopoietic cells of different lineage in the endometrium may be associated with hematologic diseases. So here in this section, we can appreciate endometrial stroma, some glandular component, and stroma contains some osteoid material. So this is osseous metaplasia. Here, this is a section showing stroma and surface epithelium. Here it is easy to identify because of its benign cartilaginous appearance. So this is cartilaginous metaplasia, and this is the section of endometrial polyp. Here this section shows spindle looking cells uh, surrounding endometrial glands, and these spindle cells are arranged surrounding a pink eosinophilic material. So this is called pseudo-rosette-like proliferation, and this is again a one type of metaplasia. Here this section shows endometrial glands, stroma, hemorrhagic or stromal breakdown, and the characteristic metaplastic change here we can appreciate is a palisaded cell present, which is like synovial membrane. So this is synovial like metaplasia, where we can see most commonly in the patient having levonorgestrel releasing intrauterine device, and this is normal synovial membrane histology look like this. So we have seen endometrial and stromal metaplasias. Now, what is the diagnostic terminology of benign, pre-malignant, and malignant endometrial epithelial metaplasias when we find this type of metaplasia? So, if tubal metaplasia with benign condition, so benign, it is normal proliferative endometrium with tubal metaplasia. If disorder proliferative endometrium is there, so disorder proliferative endometrium with tubal metaplasia, non-atypical endometrial hyperplasia with tubal metaplasia. If pre-malignant condition like endometrial intraepithelial neoplasia is there and there is tubal differentiation, so it is EIN with tubal differentiation. If malignant lesion is there, so it is endometrial adenocarcinoma, endometrial type with tubal differentiation. Now, squamous differentiation. So, mostly chronic endometritis and squamous differentiation in extensive nature, so it is called ichthyosis uteri. If isolated squamous morules are seen, it requires follow-up. In pre-malignant condition, so it is EIN with morular squamous differentiation. Endometrial adenocarcinoma, endometrial type with squamous, morular or non-morular differentiation. Mucinous metaplasia, so mucinous degenerative change or polyp with mucinous or endocervical type change or benign mucinous differentiation, and EIN with mucinous differentiation, and in malignant condition endometrial adenocarcinoma, endometrial type with mucinous differentiation, secretory type if present, so it is secretory endometrium mixed type or hypersecretory endometrium which includes area stela, and pre-malignant condition which is EIN with secretory differentiation, endometrial adenocarcinoma, endometrial type with secretory differentiation. So that was a quick overview of endometrial metaplasia, a benign yet important histopathological finding to recognize. So if you found this video helpful, don't forget to like, share and subscribe to the channel for more pathology insight every week. So thank you very much. Next topic will be endometrial hyperplasia and endometrial pre-malignant lesion. So stay tuned.